Welcome to Foresight Health. We believe outcomes matter, customers count, and value rules. I'm your host, Dave Burda, news editor at Foresight Health. Today, I'm joined by our CEO, Dave Johnson, to discuss the future direction of the healthcare system in the United States. Now, let's get started. Hi, Dave. How are you?
Hanging in there. Got my Zoom shirt on. Haven't cut my hair in several months. Kind of reminds me of that old Crosby, Nash, Stills and Nash and Young song. Haven't cut my hair, or almost cut my hair. Happened just the other day, getting kind of long. So I'm ready. I'm ready, Dave, for anything you're going to throw at me today.
Well, it does feel like we've been inside since the 70s, right? Okay. All right. Before we talk about the future, let's talk about the present, which is July 2020. What three flaws has the COVID-19 outbreak in the U.S. Exposed about the way we deliver and pay for care in this country?
Yeah, only three. Well, first one I would be, it's even more fragmented, I think, than many of us fully appreciated. Under the pressure of COVID, we saw that access was an issue. We couldn't find supplies. Caregivers being absolutely heroic, but having to do it without appropriate PPE, often not having full information about patients, and so on. So the fragmentation has always been an issue, and I think under pressure increased. Second is, I think we realized how centralized our system is. One of the great surprises of COVID is how quickly the system shifted from in-person visits to virtual visits, and just highlights that hospital care is centralized, high cost, very bureaucratic. There are other ways to deliver care. So great opportunity to move away from that high cost centralized delivery model that we've been stuck in for decades. And last, and to your payment question, we've just seen once again how much the system is driven actually by more than anything else, payment formularies. The big reason for the drop off in volume was that elective surgeries dropped off. Hospitals lost their shirts. I know we're going to get into that in a little bit. But even on the COVID side of things, people scrambling around to get the right codes, providers to some extent taking advantage of the opportunity to bill for everything they can possibly think of. There was a bill for a patient in Seattle that was 181 pages and came to $1.1 million. There was a place in Texas that was charging $2,300 for a $100 COVID test. So payment formularies really driving the way we deliver care. And you've heard me say this a million times, we're not going to change the way we deliver care until we change the way we pay for it.
Got it. Dave, how have these three flaws in the system that you've identified, fragmentation, centralization, and payment inequities, affected, what I see as the big three: patients, providers, and payers?
The three Ps. Well, patients, access has been an issue. Information has been an issue. I think many have been pleasantly surprised by the access to virtual care. Literally tens of millions of people in the last 3 months have had their first virtual care visit, and for the most part really like the convenience and the access. So for patients, mixed bag. Those that can get into care for COVID are getting great care, but getting there hasn't always been the easiest. Providers have just been getting crushed, just crushed. Something like half of the adults in the country live in households where either they or a family member have delayed care since COVID started. Volumes in the hospital, in the primary care clinics, in the ambulatory surgery centers have just fallen off the cliff. That's where the money is. And as a result, hospitals are really scrambling. The government has thrown a lot of money their way to try to stabilize, but very, very tough for providers. They're scrambling, I think, to adapt, but it's under significant duress. Payers, on the other hand, have been singing "Happy Days Are Here Again" because the money's coming in, and the flip side of providers not doing a lot of elective surgeries means that the payers are keeping the money. So we've got this imbalance between how the money's flowing relative to normal times.
Got it. Well, now let's talk about the future. In your latest book, The Customer Revolution in Healthcare, you outlined a plan to deliver kinder, smarter, and more affordable healthcare for all. Tell us how you're going to pull that off, Dave.
Yeah, personally, it's a big load, but I'm looking forward to carrying it. Well, the customer revolution in healthcare. So those words are really important, Dave. First, customer. We debated. You'll remember this. Should it be the customer revolution or the consumer revolution? Today, customers in healthcare, if you define those that pay for care, are largely businesses and self-insured companies. So we need them to become better buyers of healthcare services, and they're starting to do that. We also need to have consumers more empowered. And my hope is that one day we won't differentiate between customers and consumers, but we're a long way from there yet. Revolution. That indicates it's not going to be incremental change. We've been incrementally trying to reform this healthcare system forever. It really requires fundamental change, primarily in how we pay for healthcare. And then as we change the way we pay for healthcare, we'll also change the way we will deliver it. And that's where we get to the second part, the subtitle, Smarter or Kinder, Smarter, Affordable Care for All. It's holistic. It's supported by technology. It gets people the right care at the right time in the right place for the right price. And that for all is really important. Because I do believe we're a rich country and everyone should have access to universal health insurance. We can get there. We don't need to get there by having it be entirely given by the government. So Medicare for all, I believe in pluralistic models that allow the American innovation engine to flourish. But make no mistake about it, we can afford universal health care, but we can only afford it if we're getting value for our healthcare services. So we need to take the waste and redirect it so that everybody in the country has access to appropriate and affordable healthcare services.
Great. Thanks, Dave. Last question. What are your top three things that you think will be different in the healthcare system by the end of the year 2025? And I guess, why are you optimistic that we can get there? I guess those are two questions, but let's go with that.
Well, let me continue my answer on the revolution from the previous question, because we need three things. We need three force multipliers to get us to nirvana, right? The first, and I mentioned them, are empowered buyers. We need the people that are buying healthcare, governments, companies, individuals, to demand more value for their healthcare purchasing dollars. And as we've discovered under COVID, without patients, there's no healthcare system. Mm-hmm. So solving customer jobs to be done in healthcare, fixing them when they're broken, sustaining their health and enhancing their health. That's number one. So empowered buyers. Number two is liberated data. Data wants to be free, wants to go where it's going to be the most helpful. So we need data to flow in the right form to the right people in the right time so it can do the most good. And we're seeing enormous innovation on the technology side, and it's being supported by innovative companies that are figuring out how to use and apply the data. And that leads us to the third force multiplier, which is pro-market as opposed to pro-business regulation. We need the government to create a level playing field, let the good ideas flourish, make sure information gets distributed. We don't need the government to do what it's historically done, which is protect the entrenched interests. There's a reason healthcare companies spend so much on lobbying. They get a very high return walking the halls of Congress and state houses across the country. And let me just finish on this because I think the care in the future will be more virtual, more consumer oriented, more immediate, more affordable, more players, all of that stuff. And we need to make it happen, because if we continue on our current path, we're looking at an America that has ever more chronic disease, spending ever more money to treat that chronic disease, resulting in a society that is sicker, has greater inequality, is less productive, is less happy. And who wants that for America? On the other hand, if we can figure out how to deliver the same or better health care for less money, we free up enormous resources to pay people more money, invest in productive industries, and really support the types of community and economic development that will make America thrive. So fixing healthcare in many ways means fixing America.
Got it. Now, what have you seen that makes you optimistic that we'll be able to realize what you've described?
Well, probably the biggest one, Dave, is when we truly change the payment models. For example, we pay pretty well for dual eligibles, so people that qualify for both Medicare and Medicaid, and we do it in a very robust per member per month fee. So it's paid up front, and then the companies have to figure out how to manage these people. So this is a group of people, Medicare and Medicaid, so old, poor, and often very sick. And it's been remarkable the number of innovative companies that with that formal payment have come into the space and developed just great ways of getting to know their customers, proactively working with them on their health. We've got one here in Chicago, Oak Street Health, that's been very successful. And in a 1 month period of time, they went from having 98+% of their visits in the clinic to having 98+% of their visits done virtually. I mean, that's the kind of power to change that the market can give if it's regulated in the right way, it's pro-market, and we focus on outcomes. So that's what gives me hope. I also will say I've got some trepidation because this healthcare industrial complex is massive. Lots of people make lots of money on the status quo. That's why we need a revolution, because those that benefit from the status quo are perfectly happy having the rest of the country pay them lots of money for really not delivering what the American people need. So revolution, baby.
Right on, brother. All right. Thanks, David. And thanks again for your time today. It's very much appreciated.
Always. To see you in a collared shirt in a nice room like this, I mean, it's a special day for me.
Many people here have asked me that same question. So thank you for listening to this episode. If you'd like to join over 5,000 healthcare executives who read our weekly newsletter, you can subscribe to Foresight Friday on foresightshealth.com.